Doctors are focusing attention on something that we don't always think about when health and wellness is brought up. February is Children's Dental Health Month. And today I have a good friend that I want to introduce you to. Dr. Eileen Crespo is joining us from Delta Dental to go over why dental health is so important and the best practices. First of all, Dr. Crespo, thank you for taking some time for me.
Thanks for having us.
You know, even look at that smile. There we go. We're talking about dental health, but before we get into the specifics, when it comes to dental health, how is it all connected to our overall health?
That is great, actually, and I'm really thankful for this opportunity because I do think that too many people don't understand that your teeth are intimately connected to your body. And actually, there's good evidence showing that when you have poor oral health, you can actually have a higher risk of having things like diabetes, have heart disease, strokes, have preterm delivery of babies. So there's actually a lot of connections that people need to understand and why your oral health is so important.
That's so amazing that it all gets connected, right? Let's talk about it from a kid's perspective because it's better to start younger. I know that you specialize in pediatrics. Tell me a little bit about what we should be thinking about for our kids.
It's something that as a pediatrician, I'm counseling families really every day in the office. So the American Academy of Pediatrics recommends that kids go to the dentist by age 1, and that's really different. I don't think a lot of parents maybe know that that's the recommendation and think, oh, my child doesn't need to go until they're 3 or 4 or 5. We sometimes have kids who are, well into elementary school and never been to the dentist. So it's just really important to start early, really teaching kids those important habits of brushing their teeth every single day, twice a day, using fluoridated toothpaste, flossing, and then that healthy diet. Those things really together is really what can create good oral health.
It's amazing to me when we talk about health and equity. And I think sometimes people just don't think about oral health and equity. But there is some gaps there. And from my understanding, Delta Dental gave out these health kits to 50,000 kids across the state. Tell me a little bit about this initiative and trying to close this equity gap.
So Delta Dental of Minnesota Foundation has their program Smiles at School. Obviously, it's February, as you mentioned. We're in Children's Dental Health Month. And so these awesome backpacks are being distributed to over 50,000 first graders across the state. The program has been growing every year. And this year, we're actually going to serve schools in every single county in Minnesota.
Wow.
So more than 600 schools are going to participate, and their first graders are going to get these awesome backpacks with all the oral health supplies.
And I see it. We have, a toothbrush. I love the timer right here because I think sometimes people don't realize that you need to spend a little bit of time, right? And we have the floss as well as the toothpaste. Why is it so important to have these things?
Yes. So one thing is, Alexis, you've hit on the most important thing that most kids really enjoy, which is this timer. So we want to make it as fun for kids as we can, and we want them to keep going. I think too many kids are, if they are even brushing, are brushing and done. And it's really important to do the whole 2 minutes, brushing all surfaces of your teeth and really going until the sand all gets to the end of the timer. But this is what kids really enjoy playing with. We want them to put it in the bathroom and keep it right next to their toothbrush and use it.
Doc, I have some adults that need this right now. I appreciate you for coming. And of course, we'll have more on this on KARE11.com. Ben, I have a present for you, my friend. 2 minutes. 2 minutes, they